When this epidemic started, it was experienced by a tiny number of people. And it was scary in a way that I think we can't calculate now. It was an unknown to everyone involved. We take our name from a man called Terry Higgins. In 1982, he was working by day as a typist and computer programmer, and by night as a DJ in Heaven nightclub. One of those evenings he was working, he collapsed and got moved to St Thomas's Hospital. They did not know what was wrong with him. And after some days of tests, he released himself and went back to a shift a few days later at Heaven nightclub, where he collapsed again and got transferred back into the hospital. His partner at the time was asking whether it might be this unknown illness coming over from America. And they weren't able to talk back to him about what they thought Terry was going through, because they didn't recognize the queer love between them at the time. Their relationship just wasn't recognized. Terry sadly went on to die with Rupert, his partner, watching. And it was traumatic for many. He didn't get his, Rupert, his partner, didn't get it confirmed what Terry had died for until he had to read it in a medical journal, because they wouldn't share with him what he had experienced, because he wasn't quote unquote family. So at that time, there wasn't even a test for the HIV virus. In fact, we haven't even named the virus that was causing what was then known as GRIDS or AIDS at the time, gay-related immune deficiency, or we now know as acquired immune deficiency syndrome. Terms that both of which have gone out of date really, and we don't use anymore. But it was a real time of fear. And the injustice that was felt, not only by Rupert, his partner, but his friend Martin and others, led them to turn their anger into action. And they founded our organisation as the first HIV response organisation anywhere in Europe. And we are proud of them for doing it, and so thankful that they did. Their key insight was that nobody should have to go through what Terry went through, experiencing the virus, or what they went through with an untimely death of a friend and loved one. And they were determined to take action. And they wanted to plaster his name over our organisation, not to make it about Terry, but to make sure all the conversation going forward about HIV and this virus and how it impacted people was about humans and their lives, that we remembered there was real people experiencing life-changing and sometimes life-ending conditions because of this virus. And we continue to proudly work in his name since. And that insight has served us well over that time. Since the time of Terry, the epidemic has changed in many ways. Care developed quite quickly, so people could be looked after in those late stages going forward. We then saw tests that become not only effective, but reliable for people that they could trust in going forward. And in 1996, treatment became available that was effective, a triple treatment that worked to control the virus and reduce its impact on your system. That treatment has evolved and developed still, and there are a myriad of treatments for people living with HIV that all do the same thing. And fundamentally what they mean is if you are taking your medicine, you get two great benefits. Firstly, the virus is no longer attacking your immune system. So you can live long, healthy lives going forward, and you have to worry about how the virus might be impacting your health or well-being. Secondly, people on effective treatment cannot pass on the HIV virus. No ifs, no buts. They did a study with 2 million acts of condomless sex and not one HIV transmission from those on effective treatment. It is a remarkable step forward. The science is clear. So if you only take one thing away from this World AIDS Day talk, it's that people on effective treatment can't pass on the virus. It's important that you know that you share that, and that you pass on that message that people living with HIV can't pass it on. Because at the core of all HIV stigma is the idea that somebody is quote unquote infectious. And that is just not true now. And it's important that we work together to fight that stigma and ensure that those living with HIV can live well going forward. So from those early days, the organisation decided it had to prevent onward transmissions of the virus and care for people. The term back then was people living with AIDS, and we would now say people living with HIV. So there was a lot of behaviour change that we did. And you've seen our posters, hopefully, around London for years. Our Safer Sex campaigns in the early 80s saw a dramatic decrease in gonorrhea and chlamydia amongst gay men in particular, seeing the behaviour change from people using condoms for the first time or routinely. And we know, therefore, that stopped onward transmission of HIV and saved very, very many lives at that early point. We've been running testing week campaigns, condom, PrEP, PEP, and other information campaigns going forward. So people are equipped and empowered to take charge of their sexual health and know how to keep themselves and their partners safe and healthy going forward. We've also run campaigns to fight that stigma. Just last year, we were running a campaign about how life has really changed for the people living with HIV. Not the doom and gloom that you'd expect if you were listening to our day-to-day media, but people who've had life-changing experiences for the better. Our chief executive is living with HIV. We had a nurse, we had a pilot, we had a priest, we had a mayor, we had people from all walks of life who are living their best life while living with HIV. They were fighting that stigma, and we were proud that we were able to put people living with HIV front and center in that discussion, fighting that stigma going forward. So you will have seen, hopefully, our stuff from everything from London buses to tube stops around the country and big poster billboards, so we can change hearts and minds of people. And we can only do that with your help and support. But we've been creating change around the system as well. We don't just go for the public and their attitudes, we go for the politicians and their policies. So over the years, we've been part of key parts of behaviour change. In 1995, we got it protected in law that you can't discriminate against somebody experiencing AIDS, as it was then known at the time. In 2010, we got full protections in the Equalities Act for people living with HIV in employment and the delivery and facilities of goods, delivery of goods, services and facilities. So people are well protected if they're living with HIV under the law, and that's thanks to the work of us and other organisations. Our friends at NAT, with our support, fought the government to make sure PrEP was available and went to court to make the NHS do it. We've recently got a HIV action plan and new funding for HIV testing in our hospitals. So the support you give us isn't just to ameliorate the problems and to provide individual and one-to-one care for people living with HIV. As great as and important that is, we have a phone line, we have counselling, we have anti-stigma workshops, we have a hardship fund, all those things that mean that those people living with HIV don't affect some of the harshest parts of society. We're there for them. But we're also there at the root causes. We're trying to be the vaccine, not just the plaster, for some of the problems and experiences they have. And your support for our campaigns makes a real difference going forward. And with that, we are changing society. Rupert, who I talked about earlier, Terry's then partner, argues strongly that we wouldn't have had gay marriage in this country if it hadn't have been not just for the AIDS crisis, but how we as an organisation and as a community had responded to that, changing people's perceptions about the love between same-sex couples and allowing that compassion to come in from the country. And we've changed hearts and minds in other ways. We've made sure it's legislated so that people have got inclusive sex education in all of our schools. We've made sure that testing is available across the board for people, no matter who you are and what community you are from. So things have moved from those dark days where the LGBT community was stigmatized with the AIDS crisis with grids to a time in which people living with HIV cannot pass on the virus. And that means that we have all the tools available to end the HIV epidemic here in the UK. We have the ability to find everyone living with HIV. Testing is available in more and more places, and we're pushing for that to go further. We have great HIV care, and we've got to work harder to retain people in the support of a HIV clinic. But when they get there, it is generally world-class, excellent care. We have the tools for those who are not HIV positive, that don't test positive for a test, to stay negative. People know about condoms. There's something called PEP. So if you've been exposed to the virus, you can take essentially a morning after pill for HIV and make sure it doesn't take hold in your system. We have a thing called PrEP, almost like the pill, if you will, for HIV, a drug that you take when you test negative to stay negative. We have many tools available. We've just got to deploy them properly. But because of the NHS and the great work that it does underpinning the health of the nation, it is possible that we can do it and deploy all those measures. So last World AIDS Day, we got 20 million out of this government to fund opt-out testing in A&Es in the highest prevalence in the country: London, Brighton, Manchester and Blackpool. So everyone who goes to A&E have a little bit of blood taken, and that will be tested for HIV and sometimes Hep B and Hep C as well. It's doing a remarkable job. In just 100 days, they've diagnosed 128 people living with HIV and found 63 people who were previously diagnosed but lost to the care of a HIV clinic. That is 200 people on top of all the other testing and all the other work that's being done, 200 extra people that are being diagnosed just in 100 days this year, that will no longer have HIV attacking their system and will no longer be able to pass on the virus going forward. That is a remarkable change. And they're invariably from communities that would be diagnosed late if that testing wasn't in place. So we have made a difference, and we've only made a difference with your support. Ending new cases by 2030 is not a pipe dream. It is a working progress. It is possible, currently not probable, but with your support, the Terrence Higgins Trust, with our partners at NAT, Elton John AIDS Foundation, and many others, will do all the work necessary to bring the funding from government, the support from the NHS, action from our clinicians, the work in the community to ensure that we end new cases of HIV, have nobody dying of a HIV-related illness, and that we fight the stigma day in, day out. Thank you for your support this World AIDS Day. We couldn't do it without you. La.